Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 with our 145th video on this topic. This is our 63rd weekly update dating back to May of 2020 for the week with data accurate through July 29th, 2021. This week, I'm going to address a single question, and that is, how do I interpret the updated CDC mask guidelines? Pretty straightforward question. So what exactly did the CDC say this week? They said to maximize protection from the Delta variant and prevent possible spreading it to others, wear a mask indoors in public if you are in an area of high or substantial transmission. They did add to that something that hasn't been reported as much in the media, but that is if you or a member of your household is at increased risk, you may choose to wear a mask. So what's complicated about this, of course, is substantial or high transmission. You know, in a way, it's analogous to using an umbrella if you go outside, right? If it's raining, you're going to use it. If it's not raining, you're not going to. But it's a little bit hard for folks to know. So the CDC also issued a map. On this map, red is high, orange is substantial, yellow is moderate, and blue is low transmission. And if you look at our region, you'll see that there's mostly red. If you look at Tennessee, there are 10 counties that are listed as moderate, 19 substantial, and that means 66 are high risk. So basically across the state, this is a high risk area, and the CDC guidelines should in fact apply here. Why did they do this? Well, it's because of significant spread of the highly infectious Delta variant that we've talked about for many weeks. And while the vaccine still is believed to provide good protection against serious disease, there have been breakthrough cases. And importantly, there's evidence that people who've been vaccinated may still spread the virus. There's also evidence that immunity may wane over time, though this is still preliminary. So the bottom line is that the virus is still spreading. Delta variant, as we've talked about many times, is very much more communicable than previous variants. And how this plays out globally is 4.2 million deaths worldwide, 1.5% increase in the past week. It's been running about 1.3 to 1.9% for the last 6 weeks. And while that's much lower than it used to be, that's still 62,000 deaths last week, or 6 deaths every minute. So again, the idea that this pandemic is somehow over or had gone away simply isn't true. Where you can really see the impact of, this is daily global cases, I'm sorry. And you can see that there is this resurgence in cases. It looks like this up and down roller coaster or seesaw or sawtooth pattern that we've seen before. What's a little bit different is we haven't seen the same increase in daily deaths worldwide. It is clearly coming up, but not as steeply, and we'll keep our fingers crossed. The model that's perhaps most illustrative is the United Kingdom, where you see this huge spike in new cases from early June to the present, now coming down. But even with that, we didn't see the same kind of spike in deaths. Now, that could be because it's occurring in younger people. It could be because healthcare is better. It could be that Delta is less lethal, but probably not. I think it's just spreading widely in populations that are fortunately less likely to get seriously ill. In the US, we're seeing the same increase in the number of daily cases. But again, we're not seeing an increase in daily deaths yet, though it may be ticking up a little bit. What is worrisome, though, if you look at hospitalizations, since the last couple of weeks, it has been coming back up. Again, nothing like what we saw in the winter time, but again, this continuous sawtooth pattern, which as much as anything discourages people. So in terms of deaths in the US, there have been 628,000, 0.4% week-to-week increase. That's a little bit higher than what we've seen the last couple of weeks, but it's been 0.3 or 0.4% increase week-to-week now, going back a couple of months. A little over 2,500 deaths last week, 380 deaths in the United States every day. And that's 1 death every 4 minutes. And the reason I go into all that detail is just to remind us that this pandemic is not over in the United States or around the world. Now, last week I said that there was a disagreement between the American Academy of Pediatrics and the Centers for Disease Control about whether school children should wear masks. The American Academy advocated for all students, teachers, and staff to wear masks while indoors in school. At the time, the CDC disagreed with that, but now the CDC is recommending universal masking for all teachers, staffs, and students and visitors, regardless of vaccination status. But they both are in agreement that children should return to full-time learning. So unfortunately, the recurrence and the spread of the Delta variant is sufficiently worrisome that now the CDC is suggesting that those of us in high transmission areas, including our parts of Tennessee, should consider wearing masks when we're in indoor spaces with other people, regardless of our vaccination status. The advice still remains, so the best thing we can do is get as many people vaccinated as possible. Because even if vaccinated folks can spread the disease, it does appear that they are less likely to get seriously ill, and that's what we want to prevent. A great deal more information about COVID-19 is on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. As always, thanks to Dara Young for editing, producing, and posting this video. And please keep sending me your questions. I do my best to answer them offline, or if they're of general interest, I'll put them in the weekly update. Until next week, thank you for paying attention to COVID, and be well. Thank you.